Hey, welcome back to another health talk with me, Bokamoso Mthimkulu. So today I'm going to educate you on another heart disease, and this one is a bit more serious than you would think, and it's one that most people know about. Yes, it is a heart attack. Guys, heart attack is a very, very dangerous thing to go through, so please do take away the signs and symptoms from this lecture, because the sooner you act when you have a heart attack, the better the outcome will be for you. Okay, let's get started. Okay, so think of yourself. You need oxygen through the air that you breathe, as well as nutrients by the food that you eat, in order to stay healthy, vital, and to be able to meet the demands of daily living and all the tasks that you have to do. Your heart is very, very similar. It also needs oxygen and nutrients in order to stay vital and to meet the demands bestowed upon it by the body. Now, the way that your heart gets oxygen and nutrients is through specific blood vessels known as your coronary arteries. When you have a heart attack, your coronary arteries, or a specific part within them, becomes blocked completely. And this is generally through a blood clot. Now, when that happens, there's no nutrients or oxygen going to specific parts of the heart, which leads to cell death at that part of the heart. Sort of similar to you, if you were deprived of oxygen and nutrients, you would start losing energy, not keeping up with your daily tasks, and eventually you would die. And that is what happens in a heart attack. So coronary artery disease is the main cause of a heart attack. So I want to recap what happens in the body in coronary artery disease so that we can progress into how it develops into a heart attack. Firstly, your coronary arteries are the main arteries that supply the heart with oxygen and nutrients that it needs to do its daily task. But when we follow an unhealthy lifestyle, this is one where we eat a lot of unhealthy foods, we live a very high stress life, we don't exercise, we have other comorbidities such as obesity, diabetes, high cholesterol, high blood pressure, etc. All these factors can cause damage to your coronary arteries. And now when there's damage to those arteries, they don't function how they're meant to. Every organ system, every little thing in our body has a specific function. And one of the functions of your arteries is to keep toxins out of it so that, blood and oxygen and nutrients can flow through nicely, easily, and do its function. So when there's damage, this allows for toxins to come in and out as it pleases. And one of the main toxins that adhere to the wall of your arteries is bad cholesterol. So I want you to kind of think of it of like a wart, maybe, or a boil, or a pimple, or something on your arm, or your face, or your leg, or whatever. So that is kind of, your skin would be the same as like the wall of the arteries. And when you have that little bulge from the warts, the boil, the pimple, whatever, that is that bad cholesterol that is adhering to the wall. And the bigger that it grows is the more plaque that it forms. But now our skin is obviously different. I mean, it goes all around and it just bulges up. You can pop it and get rid of it. It's not the same in your arteries. In your arteries, it's a nice round circle and that bulge happens within them. Now, when the plaque continues to build, then you eventually block off the arteries. So not enough nutrients not enough oxygen can go to specific parts of the heart. But when you are looking at that, when you're looking at the boil or the pimple that you have, say you're walking and you bump into a brick wall or something, and now that scab is, or that pimple, whatever, breaks. That can happen to plaque in your arteries. And just how it happens in your body, you would start to bleed, and the blood would form like a little plug, to say, sort of like a little clot in that area to stop too much blood. The same happens in your arteries. So the plaque would break, and your immediate response would be your immune system forming a blood clot in that area to stop the bleeding of the artery wall. But now blood clots can be naughty and break off and wander in like a little small clot. And your coronary arteries are not that thick. It has little branches that get smaller and smaller. And so at one of these branches, this clot, the small clot that has wandered off, can block the artery completely at that point. And when that happens, you have no blood flow going through to a specific part of the heart. That means no oxygen or nutrients to that specific part of that heart, and the cells begin to die. And when the cells are dying, that's when you start to experience symptoms of a heart attack. And yes, coronary artery disease does have similar symptoms, but the way you will distinguish between coronary artery disease and a heart attack is that the symptoms of coronary artery disease are prolonged. So instead of having chest pain for, let's say, 2 minutes once a week, you will have chest pain at a specific time that is unpredictable for about 10 minutes. But within those 10 minutes, your heart is still dying. That muscle is still dying. And you must act quickly. Please act quickly when that does happen, so that less cell death can happen and less damage can happen to the heart. But yes, please, if you want to see exactly how coronary artery disease develops in the body, do click on this tag. So how it develops or progresses into a heart attack is when there is that blood clot that wanders off and causes a complete blockage within the artery, and muscle tissue cells begin to die. Now, men and women are different, so the symptoms aren't always the same for each sex. But what you're likely to experience for women would be indigestion or heartburn, nausea, vomiting, sweating, etc. that accompanies the chest pain. And men generally do feel the chest pain or pain on the left side of the body. I have included a link in my description that will take you to a website that will tell you what men are likely to experience versus what women are likely to experience. So please do click on that link, look it up, and know what you could experience based on your sex. So you have immediate treatment as well as long-term treatment. Immediate would be in that moment while you're busy struggling with the effects of the heart attack at the ER. So this would mainly be through trying to decrease the pain that you're experiencing, as well as increasing blood flow to the dead tissue to try and revitalize it. The long-term treatment would be through medication and lifestyle changes. So changing your diet, controlling any comorbidities that you have, like taking high blood pressure medication to help, high cholesterol medication to help, managing obesity, etc., and exercising. Your heart is no longer as vital as viable as it used to be. Because now there's dead tissue, there is a lot of scarring in that area. It's sort of like how a scab scars your skin. But now that tissue is not the same as the old muscle that it used to be. It doesn't necessarily expand and contract like it used to. And so your heart now needs to adapt based on that loss of muscle tissue. And so doing exercise tries to strengthen the heart and get as much functioning in the heart so that your heart can meet the demands bestowed upon it by the body. So exercise is very important in those situations. Other things that you're likely to do long term is revascularization surgeries. So this is to help reopen the blood vessels to get blood flow through there, or by using another surgery to feed oxygen and nutrients into that area of the heart. And it all depends on that. So the main cause is coronary artery disease. Now, coronary artery disease is caused by specific risk factors that cause heart disease. So all these risk factors can lead to most types of heart diseases. And these are generally your high blood pressures, age, family history, high cholesterol, pre-diabetes or diabetes, obesity, etc. And so managing those risk factors will inevitably help in preventing getting a cardiovascular or a heart disease. So the best ways to prevent heart attack is through exercising. So doing something as simple as a brisk walk, 30 minutes a day, 5 days a week, every single week, is a great way to strengthen your heart and get blood to flow nicely around the body. But if you want to jog or cycle or swim or whatever, those also do help. Also, eating healthy is very important. Decreasing junk foods, sweets, etc., cool drink is important. You want to get your vegetables, your meat, and or protein if you don't eat meat, etc., into your body to get those right minerals and vitamins and antioxidants that the body needs into the body. Decreasing stress is important. Stress can also cause damage to the body that we don't even think of. So, going for a walk and stuff does help in changing your scenery. Meditating is also another way to try decrease stress. But if you already have a comorbidity, if you do have high blood pressure, high cholesterol, etc., taking the medication that your doctor has prescribed for you, how he has prescribed it for you, is important, because missing days and all this does not do the body justice. And so please, guys, do take your medication as it has been prescribed for you. Now remember, with prevention, you can't just exercise and think that things will be okay. You have to do everything that I've just said. All of it is like a holistic way of seeing yourself. Guys, thanks for watching. I hope that this information is useful for you. Do leave a comment if you did enjoy it, if you have any suggestions on how I can better my videos for you as well. Also, if you're new to my channel, do subscribe. Click that bell, get those notifications so you are informed when I do upload new videos. Guys, I will see you next week with the next video on my life story of living with multiple sclerosis. Alright, enjoy your week. Bye.